We were supposed to meet at Strange Brew, but we're meeting here. How was the drive down?
It was actually very pleasant since they got the new road done, 69.
Okay. The first question I wanted to ask is, could you describe your role at the company that you formerly worked at?
Okay, I formerly worked at the Rowdebush VA Medical Center in Indianapolis, Indiana, and I was a clinical neuropsychologist there. Mostly there, I met with people and did interviews with them, and then assigned a battery of tests to be given by a technician there. So they would come in with all types of presenting problems like Alzheimer's disease or traumatic brain injury, or any number of different types of dementia, and they would need testing to see whether they had the capacity to live on their own, or how severe their memory deficits were, or whether or not they could get transplants if they had the ability to understand and follow through with aftercare instructions, that type of thing.
Would you know if you were successful in your role in the first 90 days or the first year? And if so, what did that look like?
You would know you were successful because, of course, at the end of every year, for so long, I don't remember how many, maybe the first year you're on probation. And so you have evaluations regardless every year and find out what your level of performance is. If you do, so you're rated as fully successful or just less than successful. And if you do exceptionally well or do extra things that are spelled out in advance, such as doing research that is published in peer-reviewed journals or leading groups within the hospital and things like that, then you can get extra bonuses as well. So you would know by your rating and whether or not you received a bonus.
So what would be your company's main goal, or like, what is their main thing that they contribute to?
I mean, the Department of Veterans Affairs in general, their goal is to take care of the medical and mental health needs of veterans of the, Army, Air Force, Marines.
And how does this role contribute? How does your role contribute to the company's overall goals?
Well, when I do the evaluation, then it goes back to the usually to a referring doctor. So if it's neurology and they want to know what medications to provide, then it helps the neurologist to decide. If it's, surgery and they want to know, can this person handle getting a hip transplant? Do they understand the risks? Can they follow the aftercare instructions? Then it helps the doctors be able to treat them.
Okay. How would you describe your work environment? Like, how were the coworkers?
Coworkers are great. It kind of is like a mini military facility in the sense that it just operates like that. Everything is timely and inflexible. So, there's no working from home or leaving for lunch or whatever. It's very militaristic like in that way. The chain of command is the same as well. So you're under your supervisor who's under their supervisor, and it's not like a collaborative work environment per se.
So you didn't have any other work with coworkers?
Oh yeah, we have team meetings where you present a case and you get your fellow psychologist opinions on how treatment should proceed, or if they have any other insights into there. And it's collaborative in the sense that you work with other departments. So like I said, we worked with the pain clinic, the surgery clinics, the neurology clinic, the primary care clinics. Yeah.
So speaking of like your boss and his boss, how did you and your boss typically like collaborate or communicate goals or objectives?
Well, every year you have the meeting where there's pages of information.
There's only a yearly meeting?
I mean, pretty much that you'll have a yearly evaluation, yes. But you meet far more often than that for different types of meetings. So every week at the very least you meet to discuss cases and share with one another. We also collaborated on research papers and things like that, but everyone I don't know, neuropsychology is kind of a specialist role there, so,
In what way?
well, when I worked there, at least in the beginning, I was the only neuropsychologist there, so if I needed to consult with another neuropsychologist, it would have to be done at the IU Medical Center or, with some of my former mentors at the University of Michigan.
Okay. Are there opportunities there for mentorships or professional development?
Professional development, back in the day, before there were remote things, we used to get so much money to travel every year to conferences, which was fun, and they would have continuing education credits, so they would have educational activities presented by other psychologists and approved by the American Psychological Association, where you would learn. Now things are mostly remote, and the VA doesn't pay for you to travel as much, but yes, you can do it remotely. You're required to do a lot of things on training on the computer, but they don't necessarily relate to neuropsychology. But to keep your psychology license, you have to get so many hours of training every 2 years. So,
And did you enjoy working there?
I loved working there. I loved the patients, and I loved my coworkers. I did not like the fact that it was completely inflexible, so I was unable to either get my kids on the bus or pick my kids up from the bus because there was zero flexibility. They don't offer maternity leave, so you use up all your sick time, all your vacation time when you have babies, especially 3. And so I hated the inflexibility, but I loved everything else.
How well did you get along with your boss?
Great.
Next question would be, how would you describe the company's culture if they have any?
Militaristic.
Figured you'd say that. So in what ways does the organization support employee growth and learning if they don't allow for people to take vacations or like educational leaves?
Well, you do. I mean, you do get vacation days, and if you're not having children, they're really quite generous, but when you're using them up on maternity leave, it doesn't seem generous anymore. So, that is a big issue, really, I think, for new parents. But in terms of supporting your development, they do allow you to have time to do research, which I enjoyed, and they give you so much free time every week where you can use that to do your research if you want to, and that is pretty fulfilling, I think. And you get to choose your area of research, of course, so they allow you to do that and pay you to pursue your interest there, and then give you bonuses if you're successful.
And then speaking of free time and calling off, how much time did you get off, including like sick days or vacation?
Oh gosh, I've been staying at home for several years now. It's hard to remember. I think you start maybe with, it's all spelled out according to your level. Like you start at a certain level, like GS 13-1, and the more you progress up the levels, I think I made it up to the end, like GS 13-10, I think.
Which means you get more time off?
Yeah, the longer you work there, the more vacation time you get. And as you know, just from thinking about the mail system, you get a lot of holidays off as well, so. I think you might have ended up, I don't want to say, I'd have to look it up.
How are performance reviews conducted? Because I know you said they were conducted once a year, but how are they conducted? Like, what is your evaluation?
There's a packet of things that you're supposed to be doing, and
What's in the packet?
it depends on what your job is. Like I said before, the neuropsychology is kind of different. So a lot, like if you do therapy, it's based on your number of billable hours. But neuropsychology is kind of a unique thing that, at least at the time that I was there, it doesn't have the same requirements because it's different. Because a lot of your time is spent writing reports. But
So what would be the difference between neuropsychology and regular psychology?
like regular psychology, if you're doing therapy anyway, like neuropsychology is mostly testing to see how you're doing in terms of cognitive skills and how that relates to your behavior.
Of people that have schizophrenia and whatnot.
Sometimes, but they don't usually have a huge need to be tested for that. You know, usually it's people with brain injuries or dementia. But so it's kind of, they look at the number of reports I wrote every year. I would sit down in my boss's office with him, and we would go over the packet. It's, I think, somewhat based on if you collaborated or ran groups. They want you to run different groups. Like I ran a diabetes group. Things like that. So there are different objectives based on your job, and you sit down and discuss whether you're meeting them or not.
Okay. What is the typical career trajectory for someone in your position when you first got there versus the end of when you were there? Think you get higher?
Usually it takes quite a long time to get from a GS 13.1 to a GS 13.10 because you only progress every so many years. But when I was there, the psychology across the nation kind of bonded together, and they came up with ways to help people advance faster if they were productive in terms of research or grant funding, things like that. So because of that, I did a ton of research and did other things like in other departments, which gave you points. So I progressed through the steps very quickly. So, you know, within my first 10 years, I was already as high as I could ever possibly go, unless I took a job as a supervisor or something like that. So
did you earn more money as you progressed through the ranks?
Yes. But that is kind of depressing that if you've done all that and you get past your first 10 years, then you kind of don't have any more goals because you can't get any more, you can keep getting bonuses, but you can't keep advancing.
Yeah. Give me 1 second. What is a conventional piece of wisdom in your field that you would disagree with, and why? If there is any.
That I would disagree with.
Yep. Or you can do would agree with if you want to.
Oh gosh, do I have to pause anything? Conditional piece of wisdom.
Do you want to come back to that one?
I mean, I think in the VA, you could say a conventional piece of wisdom is don't rock the boat. So,
Meaning, don't risk it?
well, they kind of want you, like the military, to kind of follow orders and not be an independent, novel thinker. And I did run into 1 year where I kind of got into some trouble a little bit because I had been trained at the University of Michigan to look at whether or not people were putting effort into their neuropsych testing. So unfortunately, a lot of times, especially in the VA, when there's money to be had by failing the testing, so if you can prove that you're disabled, then you'll get money every month for the rest of your life, tax-free, and quite a bit of it. So there's a lot of incentive for people to make it look like they are way worse than they are on the testing so that they'll get money. And while I definitely want veterans who are disabled to be funded for sure, they absolutely deserve it more than anyone else. It's not a sustainable thing for every veteran to come in and say, I need money. And it's not healthy because then they're not going to have a job and have that fulfillment of having a job for the rest of their life. They're just going to have to keep looking disabled for the rest of their life so that they can receive free money. So I wanted to use tests that look at whether or not people are consistently trying on the test, and that is well validated in research that should be done in neuropsychology. But there was a lot of backlash about that. By the time I left after 10 years, people believed me and were actually requesting me to do that type of thing, is to look at people whether or not they were being genuine or not. But introducing that to the other staff members caused a lot of trouble at first, because they didn't want people to be said that they were faking, which I did not say, but I will say if you're not putting forth consistent effort. So at the VA, I would say that you should toe the line and do what you're told, but that's not always ethically and professionally the right thing
So
to do.
you would say that you knew that quite a few people went in there faking it, and you didn't want to give it to him, but you had to,
I'd
because
say
you
that
didn't want to rock the boat.
I gave them tests, and I included in my report whether they passed the test of effort. So if it was obvious statistically that they must have been trying harder to get the answers wrong than getting the answers right, like say if you flip a coin 50 times, you should get about 25 heads and about 25 tails. But if they're getting 5 heads and 45 tails, you know that they're doing something to sway the answers. So I included that information, and that made some people really unhappy, saying that they were not trying adequately to do well on the test. So it was a years-long process of getting people to accept that this was a real thing, and publishing research was a big way that I did it, which was accepted and reviewed by peers worldwide and say, no, this is something you need to do. Like, people who are disabled should get the money. Not everyone should get the money, but people need to be genuine and honest in their presentation.
And why do you think you got so much backlash for that?
I mean, I think as medical professionals, people are generally compassionate, and you want to believe what you're being told. You want to believe that people are being honest with you, and you're empathetic. You can feel their pain. You want to do what's best for them. I believe that doing what's best for them is treating what's actually going on, and not just leading them down a path of having to prove they're disabled for the rest of their life, but being an active member of the community. So it struck some people as wrong and offensive, I think, because they believed that they had a traumatic brain injury and they would never work for the rest of their lives. And a lot of the people just believe things that aren't true about a mild traumatic brain injury. You're almost certainly going to recover, 90, a lot of, pretty much 100% of the time if you have, a mild traumatic brain injury, like a concussion. Like, you've had 3 concussions.
Yep.
But what happens is sometimes veterans get a concussion and other providers tell them, oh, well, you're never going to be able to be who you were, and going down that bad path. And I don't think that's good for anyone.
Okay. So you had a plan going throughout school and going to get your PhD. Could you describe a time you had to pivot from your original plan? And what did you decide to do?
I wouldn't say that I ever pivoted, but I always prepared for a worst case scenario. So when I went to college at Ball State, I, got as good a grades as I possibly could. I ended up with all A's at Ball State. And then still getting into psychology school, you have for every application there are 10, there are 10 applications for every spot. So just being realistic, I applied all over the country, but also had a backup plan, and I applied to a different master's program to be a chief information officer, and I got accepted to that. So if I didn't get into any PhD programs, I was going to do the chief information officer master's program.
Okay. I think that would wrap up the interview. Thank you for coming.
You're so welcome.